Hello, this is Miss Gibson. We're going to be doing a quick overview of fluid and electrolytes. So, fluids and electrolytes, we know that there has to be a balance, which is essential for life. There has to be that homeostasis or that equilibrium. If not, that's how we know that our patients are not healthy. That's how we come up with the diagnoses. If you look at this chart, it says that the percentage of water by age group, your newborns and your premature babies make the fluid volume is 70 to 80%, and then with your preemies is 90%. 12 years to adulthood is 55 to 60%. Your older adults is 50 to 55%. And we know that as we get older, becoming dehydrated is a very serious condition. Anytime that they have fluid volume deficit, that can lead to things like kidney infections, urinary tract infections. It can cause confusions, which can increase the risk of falls. So it's really important that we're monitoring our newborns as well as our geriatric population. So our function of water, it provides a medium for the transport and exchange of nutrients. It also is a medium for metabolic reactions. It assists in body temperature regulations. It provides structure. It's also a shock absorber. It provides insulation and lubrication for our bodies. Those at greatest risk is you're very young, you're very old, and you're obese. So if you look at the obese population, of course, they're going to have more body fat. So which means that there's less body water because fat cells contain less water than other cells. They have little to no reserve of fluids. So we've also got to monitor them for dehydration. All right, so balance fluid gain and loss for an adult. You need to know that sensible losses, those are things that we can measure, where your insensible losses cannot be measured. That is your sweat, that is any fluids that you might lose through your lungs or your stool. As far as your intake, that is anything that you are drinking or eating can go into that intake. For your output, the primary way that we lose water is, of course, through the kidneys. Some insensible losses, like I talked about before, is sweat, breathing. You might lose some in your stool. Of course, that will increase if you have diarrhea. You can also lose some water through vomiting, salivation, drains, suctioning. But those things can be measured, so they would be sensible losses. So your body fluid distribution, you have intercellular, then you have extracellular. With the extracellular, you have intervascular and interstitial. Intervascular just refers to the inside of the cell. This is your blood plasma. Then the interstitial is surrounding cells or between the tissue. This is where your extra fluids will accumulate for edema. So ways to assess fluid balance. The most accurate way to do so is with daily weights. You want to make sure that you are weighing your patient the first thing in the mornings after they have emptied their bladder. They want to be in the same amount of clothing. You want to use the same scale each and every time. You want to make sure that you document that. That way you can continue to absorb absorb, my goodness, I'm sorry, observe any trends that they might be having. Another way to assess fluid balance is your I's and O's. These are still very important. Your CNAs will do these a lot, but they're not as accurate as your weight. So, with your urine production, you want your patient to have at least 30 mLs an hour, no greater than 400 mLs in 24 hours. If they are having a large amount of urine or not producing enough, both of those are serious health conditions, especially in your geriatric population or if your patient has comorbidities. You want to make sure that you're assessing for that. So, movement of fluid and electrolytes, these four things are very important because we know that electrolytes work together to keep things moving in our body, to keep things in a homeostasis. You want that normalcy. And if you didn't have things like osmosis and diffusion and filtration, the fluids and the electrolytes wouldn't be moving. So very, very important. With osmosis, this is movement of water from an area of lower concentration to higher. The movement of water across the membrane will continue until the concentration of particles on each side of the membrane are equal. You want that equilibrium. So a solution, this is the mixture of the solvent and the solutes. Your solvent, which is the water portion of the fluids, and then the particles that are dissolved in that water are called solutes. That's very important. So solution is a mixture of solvents and solutes. Your solvent is the water part, and your solute is the particles that are dissolved in that water. So osmolarity, this is the concentration of those solutes in your body. You need to know that this reflects the potential for water movement and water distribution between and within body fluid compartments. So here are some of the different solutions that you will see ordered once you get into your clinical setting. We know that isotonic has an equal concentration of both solutions on both sides of the membrane. That is the same concentration as our body fluids. Examples of that are normal saline and lactic ringers. Your hypotonic, this is increased concentration of H2O, which is your solvent, and decreased concentration of your solutes or your substances. So to maintain water balance, water moves from extracellular fluid into cells, which causes the cells to swell. This helps with circulatory volume expenditures. So once you have this expansion where the cells swell, they will swell and they will burst. One example of that is half normal saline. The next one is hypertonic. This is a lower concentration of water and a higher concentration of solutes. This will be given a lot with cerebral edema or when you need to expand your circulating volume. One very popular solution that might be ordered if you needed hypertonic solutions is 10% dextrose or the 3% normal saline. There's a table in your book that goes over this as well, and that's table 13.3. So with diffusion, this is movement of particles in all directions, but they move from a higher concentration to a lower concentration. So one way to remember diffusion would be thinking about when you spray perfume in the air. And it spreads, you can actually see some of the particles spread throughout the atmosphere. Another example is movement of oxygen and CO2 through alveoli. So, through alveoli and blood. Oxygen moves from alveoli, which is higher concentration, to the blood vessel, which is lower concentration. Then the CO2 moves from the vessel, which is higher, to lower, which is the alveoli. So just know that it's moving from higher concentration down that gradient to low. Facilitated diffusion does require energy. This refers to when you have to have a facilitator to get you from one place to the other. One example of that is glucose. Glucose cannot cross some of our cell membranes, so it has to have insulin as a facilitator to do so. Filtration, this is transfer or movement of water to This is transfer or movement of water from an area of increased hydrostatic pressure to an area of decreased hydrostatic pressure through a membrane. So we need to know that hydrostatic pressure is water pushing force. So this is the force that pushes water outward from a confined space through a membrane. One example of this is blood pressure. It moves whole blood from the heart to capillaries where filtration occurs to exchange water, nutrients, and waste between blood and tissues. Another example is kidneys, where water and small solutes moved from blood vessels to kidneys, but protein and cells do not pass through. So we know that protein is a big molecule, and it should not be passing through the kidneys or the glomerular filtration process. I get all tongue-tied because it is so big. With your osmosis and filtration, they can act together at the capillary membranes to maintain normal extracellular and intercellular volumes. Thirst mechanism is an example of how the osmosis helps maintain homeostasis. When you feel thirsty, it's caused by an activation of a brain cell that is actually responding to changes in your extracellular osmolarity. So the body is just an amazing, amazing thing. So our active transport, this is ATP. This is when your molecules require energy for movement. Your ions will move from an area of lower concentration to higher. Normally, they're moving uphill against that osmotic pressure. The ATP that is formed in the mitochondria in the cells. Some examples of substances that require this ATP is sodium, potassium, calcium, iron, hydrogen. An example of this would be glucose needs insulin as the energy source or the facilitator to enter the cell. It has to have help doing so. So next we're going to move into electrolytes. These are substances whose molecules dissociate or split into electrically charged particles known as ions when in water. So your cations, they are your positively charged ions. Then you have anions, which is negatively charged. And I have some examples of those right here. You do need to know those. One way that I remember that a cation is positive is the T goes with being positive. That's just kind of a way that I've always remembered that. We also need to know the function of electrolytes, which is regulation of water distribution, transmission of nerve impulses, and it also helps in the regulation of acid-base balances. Now, let's talk about hormones. So, we have 3 hormones that assist in the control of fluid and electrolyte balance. These hormones help to keep that homeostasis, which is really important. The first one is aldosterone. This is secreted by the adrenal cortex when the body is low in sodium. We know that sodium is in the extracellular fluid, so the adrenal cortex will get that information and it will secrete aldosterone. ADH, which is that antidiuretic hormone or vasopressin, this is released from the posterior pituitary gland in response to blood osmolarity. When there is a requirement for water retention, this ADH will be released from the posterior pituitary gland. The natriuretic peptide, this is secreted by the atria and the ventricles of the heart. This actually, many years ago, the doctors would actually order for patients to be on bed rest. There are studies that show the heart will release this peptide if they're laying on their back. I don't think that that's used very much anymore, but it used to be a thing. And then with your BNP, this causes a decrease in circulating blood volume and a decrease in your blood osmolarity. So make sure that you're aware of those 3 hormones. So regulation of fluid and electrolytes, you have your thirst centers in your hypothalamus, your kidneys, which your kidneys are the primary organ for regulation. It removes waste. It also helps maintain proper water balance. Then your renin, angiotensin, aldosterone system, which is your ROS. This is on page 166. This ROS is secreted by the adrenal glands. It helps maintain water balance, as well as maintaining sodium balance. So, it is secreted in response to decreased blood volume, decreased sodium, and high potassium. So remember that sodium and potassium kind of go against one another. It also helps maintain blood pressure. Your antidiuretic hormone, that's very important as well. It's secreted by the posterior pituitary. It regulates water retention or reabsorption by the kidneys. And then the last one here is this natriuretic peptide. It's a hormone that's released by the atrial or ventricles in the heart. This peptide promotes sodium wasting and diuresis, which causes vasodilation. So this that is released from the atrial and the ventricle muscles is actually very beneficial when you need your patient to be diuresed. It causes vasodilation, so your vascular is expanded, which helps to move fluids. This is just a picture of that ROS. It's a major regulator of blood, of fluid balance. It pretty much starts when the kidney sense that your blood pressure or your blood volume is decreased. your body will release renin. That activates angiotensin, which then converts it to angiotensin 1. Then that is activated by the ACE enzyme, which becomes its most active form of angiotensin 2, which starts different processes to increase volume and blood pressure. So a lot of things happening here. Make sure that you look over that. There are some drugs that actually disrupt this ROS. One of those is ACE inhibitors in ARBs, ARB. Both of those disrupt this, which helps lower blood pressure. So some other regulators, you have lungs, you have your parathyroid, your skin, heart and blood vessels, as well as your GI tract. This is the end of the introduction. There will be a couple other recorded lectures that you'll need to listen to. If I have confused you or if I have misspoken at all, please make sure you email me. I'm here to help you. Have a great day. Thank you.